Hello and welcome to Eklavya Overseas. This is Purnima Chauhan again, and today's video is going to be quite interesting for many of the students who are looking to pursue their MBBS from Russia in 2024 but struggling to get the complete information, especially on the NMC regulations, if Russia is following all the NMC regulations or not. So as we all know, and we are since last year we are keep on listening the NMC regulations, NMC guidelines, the licensing clause and many other things which is related or which is mentioned by the National Medical Commission in their gazette. So first of all, before moving ahead with the video on MBBS in Russia and how it is complying with all the NMC guidelines for 2024 intake. So before moving ahead to the topic, I would like to describe the main guidelines quickly and precisely. What are those factors? There are four most important guidelines that NMC has mentioned in their official gazette. I have already discussed a lot about this topic in my previous video, so just if you want to check everything in detail, you can just click on the I button and watch my previous video to know each and everything in detail. But to be very precise, there are main four factors that I am going to discuss in my today's video, and on that basis I will tell you whether Russia is following all these guidelines or not, or Russia is complying these guidelines or not. So being an Indian students, it's very important for them to follow all the regulations, all the preliminary guidelines that have been mentioned by the National Medical Commission in their gazette. Number one is the duration of the course, which is they have mentioned is 54 months. It cannot be less than 54 months. The number two would be the duration of internship. So other than 54 months of MBBS, they have mentioned that the candidate who is doing their MBBS in abroad should also complete another 1 year or 12 months of the clinical or state internship in the country wherein they have completed their MBBS. Now coming towards the third guideline, which is the language of instructions. The NMC has mentioned that the medium of instruction during the entire course study of MBBS will be of English. It cannot be of any other language or any local language other than English. Then only your degree is going to be valid in India, or then only you will be eligible to sit for the national exit test in India. The fourth guideline will be on the licensing clause or the licentiate exam. They have mentioned that the candidate who is completed MBBS in any country in abroad will be able to practice in that country, or will be able to have license or registrable to practice in that country. So this point is still very unclear among students. They are still in a dilemma whether what NMC is exactly asking about, what NMC is trying to say on this licentiate clause. So by licensing clause, they mean that a candidate should have a license to practice in the country wherein they have completed their undergrad study, or in a simpler words, or it's a clause wherein the student will be eligible to practice as a registrable doctor from the country wherein they have completed their MBBS. So now moving ahead and coming to the point, I will see whether all these four parameters are following in Russia or by the Russian medical universities. So the number one point I have discussed is the duration of the MBBS course, which is 54 months. So as you can see, the duration of MBBS in Russia is 5 years. It cannot be less than 5 years, and as we all know, Russia is the oldest country and the oldest destination for the Indian students to study, and starting from the beginning, the duration of study in Russia would always be the same, and it is almost equal to 5 years. As we can see, if we compare the total duration of MBBS, it will be of 5.8 years to be very precise, which includes the 12 months of state or clinical internship. So here second point is also clear amongst you, that the clinical or state internship is also of 12 months. So the total duration of MBBS here is 5.8 years, which includes 12 months of clinical or state internship, and the 5 years will be the rest years will be dedicated to your MBBS. So now here, when we talk about the clinical or state internship or the MBBS course, it is divided into two parameters. The first 3 years would be entirely dedicated to the theoretical things, and 70% would be the theory and 30% would be the clinical rotations. But in the last 3 years, it will be more of clinical practices. 70% would be a clinical rotation and 30% would be the theoretical part. So it goes like that. The pattern of MBBS in Russia will be divided into these two categories. First 3 years, 70% theory, 30% clinicals. Last 3 years, 70% clinicals and 30% theory. So now the third point which I have discussed was the language of instructions. So like I have told you, like when you come to Russia, the local language is Russian. But yes, unlike the other countries, Russia is one among such country. Like not all universities I am talking about. There are few universities wherein you can have proper education in English curriculum only. And how you can check about it, how you can check if the university is World Health Organization listed or if the university is approved by NMC, because NMC has removed the entire list which was there given by the Medical Commission of India. They have given us the listed universities that were approved by the Medical Council of India, but now NMC says that if a university is approved by World Health Organization, that means they can accept such degrees of that medical universities. So how you can check this? You can check the degree validity, or you can check the university whether it is listed by the WHO or not by just simply go to www.wdoms.org. So wdoms ki website par you will have easy access to this information, and you can have a clear picture about which university or which hospital which is associated with the university is approved or not by the World Health Organization. So this is one thing. Second thing which I was discussing were the language of instruction. Yes, if you are studying in Russia, you need to learn the local language, and for the first 3 years you will be having a separate subject of Russian language. But the entire MBBS course, the entire MBBS curriculum or the subject you are having during your 12 semesters of MBBS will be fully in English language. There are some universities that are bilingual who may offer you 3 years English and 3 years Russian, but like I have told you, how you can check if the university is listed by World Health Organization, you will be having a list of set universities wherein you can see if your university is fully English or not. So this is the third parameter, which is again satisfy the condition given by the National Medical Commission. So last but not the least, the licentiate clause, license to practice. Yes, Russia or Russian universities allows you, accept you, because they have a combined curriculum for all the students, be it an international or be it a local Russian student. It is same for all students. They have not divided it on the basis of categories of students. It is very common and very good ECTS pattern curriculum for all the students, and which allows you to sit for the license exam. Yes, in Russia, if you would like to gain license to practice, you need to sit for the license exam, which they have said like an accreditation exam. Like they have given it a name called accreditation exam, which is definitely yes in Russian language. So you need to pass this exam once you complete your degree from Russia, and then only you will be able to practice in Russia or registrable to practice in Russia. So I hope you like this information, and I have cleared many of the students' doubt whether the Russian medical universities are following the guidelines by the National Medical Commission or not. So yes, Russia is following all the guidelines by the National Medical Commission, and Russia being the most favorable country to study for MBBS, and it makes Russia the most eligible country to study for MBBS in 2024. Thank you so much. Do not forget to like, share and subscribe our YouTube channel Eklavya Overseas.